You, or someone you know, may be one of over 64 million people worldwide experiencing heart failure. Heart failure is a progressive condition in which the heart muscle is unable to pump enough blood and oxygen to meet the body's needs. This lack of blood flow to organs can lead to symptoms like shortness of breath, difficulty breathing, fatigue, and swelling in the ankles and feet. People with heart failure may not be able to do basic activities of daily living without difficulty, such as walking up flights of stairs, household chores, shopping, and short walks. Limited social activity also often leaves them feeling isolated and alone. Most heart failure treatments focus on using medications to try to relieve the symptoms. While these may be helpful in many people, as the disease progresses, medication therapies may become less effective. The autonomic nervous system controls many functions we don't think about. Things like how fast your heart beats, how quickly you breathe, and adjusting blood pressure are examples of this system at work. The autonomic nervous system is comprised of two complementary systems. In healthy adults, the parasympathetic nervous system helps to reduce your heart rate, and the sympathetic nervous system helps to increase your heart rate. It is common for heart failure patients to have an overactive sympathetic nervous system, which often results in inefficient pumping of the blood. A critical input to the autonomic nervous system is the baroreflex response that helps keep things in balance. The baroreflex response is activated by tiny stretch receptors found on the carotid artery, which send information to the brain to stimulate or relax your body's responses. In patients suffering with heart failure, the baroreflex response is less sensitive and stops sending the right signals to the brain, which causes the sympathetic nervous system to be on all the time. The MobiusHD device is designed to amplify the baroreceptor signal. Once the baroreflex response is restored, it sends messages to the brain to influence the arteries to relax, which improves blood flow, allowing the heart to slow down and, in turn, improve cardiovascular function. MobiusHD is implanted using a minimally invasive catheter-based technique into the carotid sinus and not in the heart. It gently pushes against the wall of the blood vessel, making the stretch receptors sensitive again. The MobiusHD is implanted without surgery, and instead, the doctor accesses your artery via a small incision at the top of the leg. It is a simple implant and is placed via a procedure done many times by your doctor. It's a one-time, short procedure that typically takes about a half hour. Patients frequently go home the same or next day. This therapy is designed to restore balance to the autonomic nervous system and reduce the symptoms of heart failure so that you or a family member can restore balance to your daily life. If you're seeking a way to improve quality of life for you or a loved one, please contact us to see if you are a candidate for our clinical trial, now underway in Australia, Canada, Germany, and select European countries. To learn about MobiusHD and how to participate in our clinical trial, please go to vasculardynamics.com/EVBA-therapy.